my greatest achievements during the 3 years at the practice is the Benzodiazepine clinic. I was new at the surgery. We were overprescribing benzodiazepines, and the partners decided that they needed me to do some work in this area. And I was just keen to impress, and I didn't really want to say no, even though I had to admit I didn't have the skill set or the experience to deal with this. I printed off a list of all the patients who were on diazepam, and I asked the doctors to help me, and they chose the people who they thought would be happier or easier to reduce. I then went to the local drug addiction clinic. I learnt that many patients were missing appointments there, and they were also complaining that the assigned key workers, they kept changing all the time. So I found it was really important for me to provide more of a structured one-to-one approach. There was a website called benzo.org.uk, and it's here that I found the Ashton's Manual. It's a protocol for the treatment of benzodiazepine withdrawal. It gave me more of an understanding on how to deal with these patients because it talked about experiences that Professor Ashton's had been through, and it really helped me later on with similar situations. By the time I set up the clinic, I felt quite confident, so I called each patient. I usually saw them face to face to begin with. Many patients claimed that they had tried this before and they'd failed. But I knew the Ashton's Manual inside out, and I really believed that there was a solution for each of them. I managed to convince them to follow my program, and eventually all 20 of them were off their benzos. The quickest one took around 5 to 6 months, and some of them took a couple of years. They all used to await my weekly phone calls, and I loved hearing how they were getting on, and I was there for them when they were going through hard times. The first patient that I successfully started weaning off just even 1 tablet a week, I remember going home and telling my family and saying, oh my God, it's actually working. One of my first patients was really pleased when I called her up. Her children had been taken away from her, and 6 months later, after she'd completed my reduction program, she'd got her children back. Getting harder and harder patients referred to me now. People are hearing about it and asking to be put onto my program. With all the skills I've learned, all the success stories I've had, I feel like I can work down my list now. Even if we reduce a little bit to the level where they can function, I do feel that I would be able to do that with every single person.